If you experience back pain during a plank, then this video is for you. My name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. And I want to welcome you if this is the first video that you've come across. In this discussion, I really want to go into why we experience back pain and how we can start to fix it. So whether you are a patient yourself dealing with back pain, you will find this incredibly valuable. But also, if you're a physical therapist, a physical therapy student, a personal trainer, working with clients and or patients, you can start to utilize this coaching system to improve the plank, but to also decrease low back pain. So let's jump right into it. So back pain is so common during a plank because planks are usually executed with an overly extended spine. So this is formerly known as an anterior pelvic tilt, and that's when we go into that arched back position, as well as we usually start to include cervical extension. So in general, we can think of we are overextended and we need to get a little bit more flexed. Now, why is this important? Well, when we're in an extended posture or pattern, the abs are going to elongate, and what that does is essentially makes them weak. A long muscle usually is a weak muscle. And so when you start to think about it, you're going into an exercise that's trying to strengthen the abs, but we're starting in a position that gives them zero strength or the ability to actually get leverage. So we're already starting way behind the 8 ball. So we need to start to change the overall pattern and position that we're performing a plank in. Now, that's easier said than done. What this requires is the ability to control and move the pelvis, specifically in my posterior pelvic tilt. All that is moving the pelvis from an anterior or forwards position back to more of a posterior. It's challenging because a lot of people are stuck and really tight and don't have the mobility, but then two, it's a really isolated movement. If you're not familiar with it, it's really difficult. So although a plank is such a common exercise that so many people do, there's actually a really difficult prerequisite that we need to master. Now here's the nice thing. We can kind of bypass a couple of steps by adding in one key tool. That one key tool is a foam roller. The foam roller is really nice because when we go on a foam roller, we can use the cylindrical shape to our benefit. This helps you really understand and increase your awareness and ability to roll the pelvis. So first thing you want to do is go on a foam roller like you're rolling out your quads, put it about mid-quad, and start to work on a posterior and an anterior tilt. An anterior tilt, the extended posture, is the one that we tend to go to and gravitate towards during a normal plank. And the posterior, where the belly button lifts up and the tailbone tucks under, that's what we're trying to achieve during a plank. Now, how do you know if you're doing it? You'll feel your abs. If you go into that posterior pelvic tilt, the belly button lifts up a little bit, you're going to feel your abs. So you can always use the sensation as a way to understand if you're in the correct position. Now let's put it all together. We now have the ability to go into a better position. Now, what are the final key steps to make sure that we kind of bulletproof our plank to A, make sure we're not creating pain, but B, maximize the execution of it? Here are the steps I want you to think about. Step number 1, head down. We tend to look up when we do a plank, and that tends to increase cervical extension. It's not the most ideal. So think about chin down. Think about being like a big old bobblehead doll where your head is really loose and not tight, not tensing. Step number 2, think chest up. Chest up happens by pushing through the elbows, which essentially protracts the scapula. Instead of being in the retracted, extended position, we are going to expand that posterior thoracic area and stay in a more protracted position. This is also going to get our serratus anterior, which is essentially our upper obliques. Step number 3, think of belly button up. Instead of letting the belly button drop, really consciously focus on pushing the belly button up. How do you know if you did it? You'll feel your abs increase. Step number 4, tuck the tailbone under the belly button. This is that posterior pelvic tilt that we're talking about. And what should happen if you do this correct you will start to feel your abs even more. So essentially, each step from step 1 all the way to the end is increasing our abs more. So if you get to your final step and you've been decreasing, chances are you're going into that extended posture. If that's the case, roll the foam roller up higher towards your pockets. Now, we're in a great position. We should feel our abs. How do we actually perform it? Don't just hold. Don't just do 30 seconds, 60 seconds, 2 minutes. Change the seconds or time component to breaths. Why? Breathing is abs. Abs is breathing. When we breathe correctly, we're going to bring the rib cage down and in. That is going to increase our abs. So we need to be able to be in this good position and then be able to breathe through it and or increase our ab tension. So while you're in this position, think about inhaling through your nose, pause for 5 seconds, exhale through your mouth, pause for 5 seconds, and what should happen is the exhale should increase your abs and the inhale we should maintain. Go through this for at least 4 to 5 breaths, and what you should find is that it should feel incredibly more difficult compared to your typical plank.